Good morning. Good morning, everyone. We'd like to thank everyone for joining us today and welcome to the Matters of the Heart Virtual Health Symposium, hosted by the Potter's House Fort Worth and presented by the Medical Ministry at the Potter's House Fort Worth and Safety Response Team. We're very grateful that you have decided to join us to hear from some of the most dynamic doctors and specialists within DFW. Just before we get started, there's a few housekeeping rules we want you to remember. Please keep your microphones, your electronic devices on mute until it's time to open up for questions and answers. And we want you to sit back and enjoy everything. Again, thank you for joining us on behalf of our wonderful campus pastor, Patrick Winfield. We truly appreciate everyone that's attended today, and we're glad to have you wonderful panelists join this discussion as well. I'm going to hand it over to Dr. Davion Wallace, who will be our moderator for this morning. And you got the con, Dr. Davion.
Good morning, everyone. Welcome to this year's Matters of the Heart Symposium. Before we get started, I would like to say take a small moment and pray. Please, we bow your heads. God, we just thank you for this moment that you allow us to come in and speak to your people. We ask your voice to come in and be a voice of healing, a hope, and peace, God. Lord, I thank you for your panelists that you have allowed us to come here, God, and let us be the hands on the earth. In Jesus' name I pray, amen. I will introduce our panelists and they will tell us a couple of things about themselves. We're going to start off with Dr. Cunningham.
Well, hello, everyone. My name is Dr. Tonya Cunningham, and I am known as the Grief Doctor. Why? Because I help grieving and hurting individuals. I help them transition from loss to life, from pain to purpose, and to recognize that there is life after loss. Is just a different life. And I do that by way of writing books, facilitating groups, individual counseling, seminars, webinars, and settings such as this. I have been in the hospice and funeral service industry for over 30 years and honored to be here with you guys today.
Thank you, Dr. Cunningham. Our next panelist is going to be Dr. Booker.
Hello, my name is Kimberly Booker. I'm a psychologist with the Center for Psychological Services. I started off actually in the schools working with kids as a school psychologist. And then I was a university professor at Texas Women's University for a few years, where I started a private practice, and from then transitioned to full-time private practice with an office in Arlington and Plano, where we see people in the spectrum of ages from small children to geriatric population. And we focus on really psychological testing, which is designed to help doctors, individuals, anybody help with the treatment and intervention for people who may be experiencing mental health concerns. We provide diagnoses and give recommendations and consultations to agencies and individuals.
Thank you, Dr. Booker. Our next panelist is going to be Dr. Kay.
Good morning, everyone. It's an absolute honor and pleasure to be here. I'm Dr. Kazigo, not Kazigo. Born here in the United States, Ugandan origin. Blessed to be in the great state of Texas here, secondary to being moved here from the Army. So my background is I started off in the United States Army back in 1996, became a physician, was educated by them, became a physician in 2002. And when I got out of the Army, transitioned into geriatrics. Our team runs a small private practice called Long-Term Healthcare Solutions, where we treat essentially the geriatric population, anywhere from debilitated people, anywhere from ages 50 to 100 plus, throughout various long-term healthcare facilities in this area. So over the past year, we've dealt a lot with patients with COVID, dealing with outbreaks in different facilities, but also on a routine basis manage matters of their heart, their lungs, their diabetes, arthritis, the normal things that you find in an older population. So thanks for having me.
Thank you, Dr. Kay. Our next panelist is Nurse Tania.
Hi, everyone. I'm Tania Lopez, and I'm actually a nurse midwife. I practice in Fort Worth. I work at JPS, and I work at Baylor, and I also work with UNT Health at Healthy Start. I work with high-risk pregnant women. I also help a team that abstracts maternal mortality cases. So that's something interesting that I do. Today, if you guys want to talk about if you're pregnant, if you're thinking about getting pregnant, if you know someone who's pregnant, or if you just have some general questions about women's healthcare, because we treat women throughout their lifespan, I'm happy to give you any information that I can, and I'm happy to be here.
Thank you, Tanya. Our next panelist is going to be Dr. Agoro.
I'll mute myself. Okay. Hi, I'm Ade Agoro. I'm a pulmonologist. I'm a sleep specialist with a critical care experience and multiple certifications. I am a physician executive and medical director covering 5 states and specialize in medical appeals. You know, I'm glad to be here and hope that we can help given the current situation in the country. Thanks.
Thank you, Dr. Goro. And last but not least, we have Dr. Cheryl.
Good morning, I'm Cheryl NEWSOME, and I'm a pharmacist. I've been a pharmacist for over 20 plus years, 25. And here in the DFW area, I had to write it. Okay, so I own Psalm 3 Health and Wellness. We're located in the Alta Mesa Tower here in Fort Worth. I also teach health science theory, pharmacology, and health science practicum at the CTE Center in Crowley ISD. And recently, my company just contracted with CVS, and we're going to actually be giving the COVID vaccinations for seniors in the in assisted living facilities and nursing care centers here in the area and DFW surrounding area. And I'm honored to be here.
Sorry, thank you, Dr. Cheryl. So we're gonna get started with our panel discussion. And the theme for our discussion comes from Psalms 4:23. It says, above all things, guard your heart. From it flows the oversprings of life. And if you look in the Bible, there are 851 uses of the word heart. However, only 19 of those reference an organ. So it's kind of funny that, not funny, but unique that today we're talking about matters of the heart and not just the physical being of an organ. So we're going to cover a lot of aspects from our mental to our social to our emotional health so that we can all be a whole being living our life and purpose. So my first question I'm going to direct to Dr. Cunningham. Can you tell us what grief is?
Yes, great question. And for you to start out talking about the heart, because grief actually starts in the heart and it moves out through the body. So grief is actually a natural emotional response to absolutely any kind of loss. And it crosses all cultures, all socioeconomic backgrounds. And in reality, all of us are actually grieving. We really are. The challenge is most people don't recognize that they're grieving because most people think grief is only associated with death loss, and it is not. Grief is not about death only, it is about loss. And every loss that we have, it demands and deserves actually to be mourned, or basically what I call acknowledged. So that's what grief really is. But I also want to mention along with that is to try to bring some wholeness. There's a difference between grief and mourning. Grief is internal. It's the emotion that absolutely everybody feels. That's why everybody grieves, whether they acknowledge it or not. The difference is mourning is external. So when you see people cry, when you see people talking about it, or screaming about it, they're actually mourning. And that's where we need people to be, is to actually mourn. What does the scripture say? Blessed are those that mourn. That's how you actually get the comfort there. And so yeah, that's what grief is.
So I want to pin that right there. And Dr. Booker, she was telling us about grief. Can you kind of distinguish the difference between grief and our actual mental health?
Well, I mean, I think it's important to kind of understand mental health in general and how it relates to other, concepts like mental illness or mental wellness. Mental health is really just the milieu of experiences that we have that include our emotional, our psychological, and our social well-being. All of that is what constitutes our mental health. Our mental health is important because it affects how we think, it affects how we feel, and it affects our behavior, and it determines how we handle stress, how we relate to other people, and how we make choices. Now, that's distinguished from mental illness, which grief is not. It's a part of the spectrum, but mental illness is when you have a recognized medically diagnosable illness that results in impairment in your functioning. It could impair the way you interact with people. It could impair how you do your job, how you feel about yourself, and how you treat yourself to a degree that is detrimental. Now, and it's important to not interchange those two terms, mental health and mental illness, because you can have a mental illness and practice good mental health practices that make you as healthy as any normal functioning, any person without a mental illness. However, you can engage in poor mental health practices without having a mental health diagnosis that make you as poor functioning as anyone with a mental illness. So I just want to make that distinction, because you can be clinically depressed, you can be clinically anxious, and still engage in practices that make you as healthy as any person who does not have those diagnoses. And what I mean by practices, I mean by, if you are, say you're depressed and you're taking your medication and you're engaging in environments that are healthy for you, you are as healthy as any person who does not have a mental illness. And just to think about where problems occur, they can come from a number of different places, because I want to reduce the stigmatism with having a mental illness. They can come from biological factors. It could be a genetic source for mental illness issues. Brain chemistry could be as simple as that. It could be life experiences, as Dr. Cunningham said. Trauma is a significant issue that can really lead to mental health problems, as well as abuse. And also watching practices in your family. If you grew up in an environment that has poor mental health practices, or witnessing someone who acts depressed or acts anxious, those are issues that can help develop poor mental health for you in the future.
All right, thank you, Dr. Booker. So Dr. K, I'm going to swing this question your way. When you're dealing with a patient and they are experiencing these grief or mental health symptoms, what does that impact on our physical heart?
Well, it was beautiful that you started off with how the Bible mentions the heart so many times. And the impact of grief, or the impact of anything that scares us, affects the sympathetic system. So essentially your vagus nerve, cranial nerve number 10, is what drives how fast your heart goes. So anything that stresses you will cause your heart rate to rise. You also hear about older people, don't stress them out as pressure is going to go up. That is literal, okay? Stress can cause such a response, such a sympathetic response. It really starts in the head. It affects the sympathetic system. That nerve goes down. It drives your heart rate. It drives how your blood vessels constrict. So stress is somewhat of a negative to your body over a prolonged period of time. It's great if you're running from a lion to have your heart rate go up. Great, run. You're out of the danger area. So it's good briefly, but for prolonged periods of time, ultimately, we want to mitigate the impact of stress and grief on your heart.
All right, thank you, Dr. K. Tanya, when it comes to women, what are some of the things that they overlook when it's their physical heart that we missed out on?
Well, that's a really interesting question and very timely right now, because I don't know if any of you are aware of this, but this in the press, that's getting a lot of press, that women die more often, Black women die more often in childbirth and in the time following childbirth. And that's just getting a lot of attention. The Surgeon General just recently put out a call to action that we need to pay more attention to maternal health and the causes of that. And the most common cause for maternal death is actually cardiac conditions. So anything, I mean, we know about high blood pressure and we know about diabetes and we know how it affects women. We know how it affects their pregnancy. We know that if it shows up in pregnancy, it's kind of a prediction for long-term health, right? But you know, mental health in pregnancy is really important too, and it gets overlooked quite a bit because on down the line on those causes for maternal death is suicide, homicide. So it's something that, you know, it's kind of like, like everybody's saying, you got to treat the whole person. You got to look at everything and all the things that are affecting your life and how it can affect your life long term.
Dr. Cheryl, when people are experiencing these moments of grief or mental health cases, what do you see in your area of expertise?
I think I'm so glad that I go to a church that addresses mental health, because in our communities, it's been it's taboo, right? So when people come to the pharmacy, they want to know how long am I going to have to take this medicine if their doctor puts them on an antidepressant, and that's extremely important to understand that. And then they want to choose, like she mentioned, you know, dealing with the whole person. When they come in and it's blood pressure medication and they want to know, how do I get over it or get off of it? Am I going to be on it for the rest of my life? You know, a lot of times the mental part needs to be addressed. It needs to be addressed, and it doesn't need to be taboo that you have to be on an antidepressant. Or now, I will caution though, a lot of people, instead of getting on some of the antidepressants or having to talk to someone about it, they'll go and get some of the alternative medications that's been on the rise. They'll go get, you know, St. John's wort came out. It's good. However, there are drug interactions that come into play with that. So say if you have someone that has a chronic condition, before you try any alternative medications, it's good if you don't feel like talking to anyone, go into the pharmacy. Walking into a pharmacy is free, and we don't keep record. So you can always go to your local pharmacy and ask questions concerning, you know, how you're feeling and mental health. And now that pharmacy is so much more clinical than counting and pouring pills and filling prescriptions, we're trained, you know, they're doctors of pharmacy that actually specialize in a section of mental health. It's not necessarily a certification just yet, but and being able to connect with other people in the healthcare field in an environment such as this opens our eyes to be able to see and be able to reach out and connect them with people that where they may not want to talk to their family about it. So, but I do caution people on alternative medications because it's supposed to be all natural, and we think that doesn't affect, but there are actually some serious drug interactions between St. John's wort and some of those things that claim to help with mental health that can actually interact with medication that's given for more chronic illnesses.
Thank you. Dr. Guro, how does grief and our mental health affect our respiratory system?
Well, you know, that's a good question. You know, I think the challenges as far as the, okay, so let me go to what are the effects? Things like anxiety, even grief can give a sensation of not being able to breathe, you know. Now, as far as the pulmonary specialty is concerned, the danger is that we like to make sure we've looked at everything completely before you decide to ascribe the problem to a condition, whether it's grief, other mental disorders, or anxiety. And that's a big challenge, you know, because it can be tempting. Sometimes, you know, when you see someone, you can tell, okay, this is what the problem is. But again, you don't want to ever fall into that trap because the other challenge is there are other conditions Again, I don't want to take time to, but things that come to mind are things like smoke-related lung disease, what we call COPD, or even asthma, So those can present as the patient complaining, but you kind of sense it when you have maximized the treatment. And then also you want to rule out other things too. So things like heart disease, the heart and the lungs were kind of, so again, that's just a general picture. I don't want to take too much time, but certainly I'm open to questions if specific ones are asked. Thanks.
All right, thank you, Dr. Garo. So based on the conversation we just had, I think we all will agree that our health is actually a conversation. We can't walk into one particular office and expect to get an answer, because we have to look at all of the things that in our environment that are affecting the individual. So I want to go back to Dr. Cunningham. So we said grief is, it comes from, it's always misconstrued, or it comes up and we are mistaken it for other things. What are things that is often made mistaken as?
Right, we do. So glad that Dr. Booker shared with us about the difference between mental health and mental illness, and that grief is not a mental illness. So what I see it being mistaken as a lot is depressed. Oh, you're depressed, especially in our culture, in the Black community, we are afraid of that D word. Although grief is not depression, depression is a part of grief. And the mildest form of depression is sadness. You're supposed to be sad. That's a common response when you lose something or someone. So it is mistaken, because a lot of the symptoms that we do see in what Dr. Booker mentioned as it relates to mental illness, some of the, as it relates to the diagnosable part of depression, we see weight loss, we see insomnia, poor appetite. All of those are common grief reactions. So again, it's seen as depression, but being okay with that. Now, if it becomes to the point, like she said, about being, it causes you to be debilitated, you can't function for an extended period of time, then you need to seek your doctor. I always ask the clients when they go through the grief process, when I meet them, number one question, have you been to the doctor? And question, the response is, no, nothing's wrong. Yes, it is. You need to see. Something's wrong. So we have to treat the whole person. It's also seen as anger. She's just an angry, bitter woman. She's going through. No, it's grief. And so what I do, I've been defined by some of my clients, they call me a poker. And at first I was offended by that. I'm like, why do you call me a poker? They said, because you poke. And I said, well, okay, I'll receive that, because I poke to get to the root of that. So it's experienced as anger, and it's also experienced as sickness. I know so many people who are physically sick, all as a result of not getting that grief out. Remember when I shared earlier that grief and mourning are different? It is so imperative that everybody gives themselves permission to mourn. Mourning is that external expression, because if you don't, you can literally grieve yourself to death. So I would say those are the top three things I see it. It's mistaken as depression, anger, and sickness.
Dr. K, she mentioned some of the physical feelings of grief. When the patient comes in to see you and they're having these type of feelings, they think they're having a heart attack, but they're actually grieving, what's that experience look like?
That experience can look pretty varied. I mean, you could start from the top down, because essentially we just go back to the good old parasympathetic, sympathetic system, where essentially you get a rush of epinephrine, norepinephrine, serotonin, dopamine that will all affect kind of your psyche, and also affect what those nerves do and how they interact with significant organs. So it can, as we said before, it can show up as chest pain from a heart attack. It can show up as difficulty breathing, as Dr. Agoro said, from, it's really parasympathetic bronchoconstriction, but constriction of the lungs. So I feel like there's an elephant on my chest. Of course, that nerve goes down to the gut. So you can find, I feel butterflies. Somebody when they're nervous or they're sick or they're sad can feel butterflies, or they can feel like have something in the pit of my stomach. I haven't gone to the bathroom in days. Constipation is a very common presentation of stress. So just all throughout that tract controlled by the vagus nerve, you have all sorts of manifestation. But of course, it can manifest itself in just pain, an increase in pain. I'm having more back pain. So somebody who is sad can basically what seems like physical disease is really a reflection of their depressive, their grieving state. So I encourage mourning, because yes, we don't want you to have to come in and get treated with all sorts of medications for something that, you know, could be easily treated by somebody like you, Dr. D.
Thank you. So before I move on to the next question, if someone is experiencing those symptoms, how long do they need to stay at home and mourn before they go see their doctor?
I would say see somebody immediately. I mean, and it really does depend on if you are a 50-year-old who has a history of high blood pressure and you've gone through a loss, whether it's you know, person passing away or a divorce, and you're feeling chest pain, please go as soon as possible. Even with young people, I would caution. So sometimes things that are unrelated will show up. So let's say, for instance, you're a 16-year-old who had COVID, right? You had COVID, you did fine, and then all of a sudden you're on the field and you're experiencing chest pain, but okay, things have been going on in your family that are messed up. Maybe a parent died from COVID during that same outbreak, that those things have happened, and you're going, well, it's just my feelings, it's just my heart. I would get things like that checked out. So it's dependent on what age you're at, what level of disease you already inherently have. If you're over 30 plus and you're experiencing these symptoms, some of it is just your body breaking down. I would go sooner rather than later.
All right, thank you. So, Tanya, I want to throw this question towards you. We talked about some of the outcomes for mental health in women and at least of suicide. Why do women less likely go see their doctors when they're experiencing these type of pains?
I think that pregnant women are afraid to take medication when they're pregnant, right? They're afraid it's going to affect the baby. And so a lot of them are going to shy away from that. And as you guys know, a lot of women don't want to go see a psychiatrist or a psychologist because it's a lot of work to go through some of those feelings you're having. And sometimes especially when you're pregnant, you just got other things on your mind and you just don't have the mental capacity to work through some of that stuff. But you know, there's other ways to deal with it. You know, we've mentioned that being stressed out puts harmful chemicals in your body, right? It can affect your baby, it can affect your health, it can actually change the development of your baby. So it's important, it's so important to deal with stressful things in pregnancy and in life, you know, and if you don't want to take medication, you guys know there's lots of things you can do. Vigorous exercise really helps to deal with stress. It helps you to, you know, and hanging out with your church tribe, going to having people that you know are supportive in your church or your family or your friends. You know, nothing makes me happier than to see two women out walking at the park, because I know they're exercising and they're getting some stuff out that they need to get out. So having that support system is really important. You can do meditation, you can do progressive relaxation. There's all kinds of apps out there now to help you with that. And in pregnancy, if you want to shy away from medication, you got to try some of those things. And that's what I really try to talk about with my clients that I take care of.
Thank you. Dr. Booker, so we're talking about how it is presented, side effects. Why do you think that they don't want to come see us, the psychologist or the counselor, so we can have them talk to these moments?
Well, I just want to start by saying that particularly for communities of color, a lot of times when they express these issues in the medical setting, they are ignored. Okay. And research has shown that Black women who bring up symptoms of stress with their doctor, they're less likely to get the attention that other populations would get. Would you agree with that, Tanya? So just to preface it by saying that, we have a history with the medical profession in general and mental health in general that predisposes us to have a certain attitude towards it. Also, to show strength is important to us. And also in mental health, the basis of, and we know what we've been going through for the last year and a half is just an ounce of what we've been going through for decades. We have to have basic needs met before we can transcend into addressing what might not be basic needs, like, oh, am I exercising, or am I going to the doctor? I mean food, I mean shelter, I mean financial stability. These are all things that take precedence over paying attention to our mental health and sometimes our medical health. And so when those basic needs aren't met, we can't even begin to address mental health needs and higher level medical needs. So part of mental health is really finding ways to establish stability in those places for yourself. Your physical surrounding, making sure you feel safe, because those all impact how you respond, your stress level. Those are some basic needs that we need to have met to start with. And I think once these communities, we in our communities start feeling safer about how we feel physically, about our financial situation, about how we feel, with people, interacting with people socially, that's the first step, and allow us even to pursue higher levels of health, both in the mental and the medical realm.
Thank you.
Mm-hmm.
Dr. Goro, in recent events with our weather and COVID-19, what are some things that are commonly mistaken when it comes to our respiratory and mental health?
I think, again, the key elements here are the trying to distinguish between what's going on, whether this is due to an underlying underlying lung disease, or is it due to the other things we've talked about, if again, some of the issues we've already highlighted, right? Because it depends on the underlying circumstance. I mean, we have a panel here of, as I'm listing the mental health or psychologists and psychiatrists here. So that strikes me as being a concern. Is this anxiety, since the current pandemic can elicit that, plus other mental issues? So trying to distinguish between, is it that, or is it an underlying problem? I heard again about Dr. K talking about somebody who is having symptoms, either depending on their age, their underlying morbid or underlying state, whether are they young, are they middle age or old, and with the pandemic, not only, as we know, does it affect the lungs directly, but the other things that are challenging are they talk about the kind of what we call a vasculitis, which is an inflammation of the vessels that can affect anywhere, it can affect the abdomen in young kids, it can cause aneurysms, it can cause so many things that we have to take everything serious, Again, I don't want to go on and on about COVID, but I think it's important though, because not only is since there are a lot of people that may not be diagnosed and they may have unusual symptoms, but also after the COVID, I see people who are on oxygen after COVID, or they're young, so people think they'll be fine, but then they've suffered about the post-COVID problems. What we call scarring in the lungs, for example. And if you're young, we're not going to, if a young person is telling us they feel short of breath, we may not pay attention to that, but it could be potentially serious. So there's so many factors that can interact, you know.
So Dr. Gore, what would you recommend? Like, what is some testing or steps people should be taking in this process to make sure they can evaluate where they are according to the symptoms?
You know, the important thing still is a good history, you know. I think, and it's hard to, we have to educate ourselves about what conditions cause, you know. I think just like we have this forum now, hopefully people have logged in, you know, you never stop learning, and we have to pass that on though, you know. So not only do we have to lay the anxiety feeling, I know it's tempting to jump to a test, you know, but as a lot of the panelists can kind of share their experiences, you know, it's taking a good history and also talking about the test before it's done. Does it need to be done or not? You know, I think sometimes we overlook that aspect because if we talk about mental health, for example, you know, again, our experts can kind of add in on this, but also the stress of the test and how is the person going to cope after the test? I mean, there's so many levels that have to be addressed, you know, and this shows itself in terms of since we're talking of pandemic, the vaccination, because it's easy. We talk about, oh yeah, there's 5 vaccines now, but the statistics, for example, again, I'm just giving examples, you know, the military, only 30% of them wanted to get a vaccine, you know, healthcare professionals, about 35% or less wanted to take the vaccine. So that should bring us down to earth and say, wow. So that's why I say, let's not, I know it's a great question as far as the testing, but also we have to talk more and relate to each other. Yeah. Anyway,
Thank you, Dr.
That's, I hope it was able to, you know, the challenge, one thing I will say, the challenge with pulmonary medicine itself, as far as the lungs is, there's really no straightforward answer. And I mean, it takes a lot of work, you know, there's no one clear cut, you know, unlike other fields. We fight with some of my joke is always like with the cardiologist, you know, and we have pleasant, because it's the heart, it's the lungs, and we're arguing, you know, that kind of highlights the complexity of pulmonary lung problems, because it's not a straight like answer that you can give a lot of times, you know, and you have to do the work, you know, to kind of check on the background. Anyway, I'll stop there so I don't take up too much time.
Dr. NEWSOME, you had mentioned earlier how people come in and try to self-medicate. Can you educate us on the difference between prescription treatment and natural?
So prescription medication, of course, is for combating disease, whereas natural medication or naturopathic medication is based off of preventing disease. That'll roll right into what Dr. Agoro was saying as far as vaccines. I think as a community, especially in the African-American community, because I think if we were to survey the healthcare professionals and even maybe some in the military that aren't willing or haven't decided that they're going to take the vaccine or not, some people are going to have to, because I do believe that they're going to make it a requirement for some people to go to work, you know, and to be around people, not just to protect themselves, but to protect the people that they're serving, the people that they're taking care of. And so with the vaccine and with the information we've been given so far, you know, if you look at media and different things, I mean, I've struggled. I've like about 3 hours the other night on webinars with doctors and nurses and infectious disease specialists from all over the United States, figuring out, or not even figuring out, everyone had their own opinion about which one was best, and they can't be mixed, and the compound is so unstable that even some of the traditional ways that we give vaccines are changing. You know, like you thump it to get the air out, you can't do that. That compound is too unstable. You mix it with the diluent. Well, you can't do that. It's too unstable. And so just hearing that, some of the doctors that were on the line was like, see, that's why I'm not taking it or this. But if it's your best defense, vaccines hadn't always been popular, but have they been effective? Yes. And has there been enough information to see why, those 25 people over there after taking it, they passed away? We don't know, there was no autopsy, so there's a lot of information that we yet to have. And I think it's the fear of the unknown. So with some of the preventative things with naturopathic medication, the two that I found that we were all able to agree on were elderberry and echinacea. Those two are going to be the ones that regardless, without all the information, regardless of what you're on, whatever your chronic condition is, those are the two that will not cause GI bleeding. They will not interrupt or interact with your diabetic medication or interact with your hypertensive medication. I know there's a lot of information out there. When you take vitamin D, and vitamin D has been proven to actually help in COVID, and actually it is the only one that is has evidence-based that vitamin D3 is actually the one that will keep you from actually, if you get COVID or if you've been exposed to it, not to get it, you won't get it as serious, you won't have the serious complications that come along with that. And Dr. Goro can probably speak to how it affects how it protects the lungs, just like Dr. K can attest to how it affects the heart, and that's all vitamin D, but vitamin D3. But with that, it has found to increase, decrease, not knowing, if you're a diabetic and it's uncontrolled. And that's another thing. In the middle of this pandemic, the one thing that a lot of doctors were saying, well, that normal, you have people dying of things that we know how to treat because they're not going to the doctor. They want to stay away. The doctors, some of them in family practice, you have to go through all these stages. And sometimes telehealth is wonderful, and it may be, and I think it's going to be part of our future. However, telehealth and that virtual health, it just doesn't give you the whole picture like Dr. Gore was talking about. If you're going to treat the whole person, sometimes you need to see the whole person, and you can't do that via video. So whatever the question was, I hope I answered it.
Thank you. So yes, we're trying to figure out the difference between the natural and the pharmaceutical. So we're going to take a quick break here. If you have questions, audience, please make sure that you're putting them inside the comments. We will be addressing those throughout our conversation. We want to pull you in. We're so grateful you had joined us and that we're able to have this discussion on your behalf. So we've kind of eased into COVID-19 and the pandemic, and eased into what if you live here in Texas, we experienced a winter storm that we've never had before. Well, not since I've been here in Texas. So it's kind of put us all in a space where do we move next? So my question, I kind of want to go to Dr. K. What is really, how do we live a healthy heart lifestyle with all the things that are around us that we're experiencing right now?
So the most important thing to remember about living a healthy heart lifestyle is essentially that you have to avoid inflammation, and you have to prioritize it. Just like you put shoes on your feet before you go outside and walk because your feet take you everywhere you need to go, you have to remember, even though your heart isn't as obvious as your feet and doesn't show up with symptoms of pain like your feet would if you didn't take care of them, it drives everything. So first and foremost, what you put into your body. So you're trying to avoid inflammation. So you hear a lot, vitamin C, decreasing inflammation associated with COVID, vasculopathy, basically the inflammation of the endothelium, the inflammation of the inside of your blood vessels. Keeping those pipes clean is the primary thing to begin with. So health-wise, what are you trying to avoid? You are avoiding things that will develop plaques. Those things are fats, animal fats primarily, sugar, and you know how our sugar is in everything. Sugar is in Cheetos. So things that have wheat, things that have corn, things that will inflame the lining of your endothelium over time will clog up your pipes. So first, be mindful of what you put into your body. Secondly, be mindful of using your heart. Spending 30 to 90 minutes, and really like 90 is like 90? Yes, 90 minutes of exercise when you can get it. And it's not always simple, but 30 to 90 minutes of low level cardiac exercise. For those of you who don't have time, we'll then do a high intensity interval training workout. 15 minutes of aggressive exercise. And it's as simple as turning on the TV or turning on your phone and just finding a hit video and just moving your body along. Stand next to your bed. Anywhere you are, you can stand next to your bed and get exercise. You can do sit-ups, you can do push-ups, you can do high knees. Just dedicate 15 minutes, set a timer, and just do it. Even if it's just jumping jacks, that is phenomenal for your body, and it's something anyone can do. So those two things are the primary component of living a heart healthy lifestyle. Now, in the African American community, I'm looking at Dr. Agoro, okay? It doesn't matter, and I tell many people a lot of times that we run across a lot of African Americans who work within the nursing home community. And so we've seen young men who every single body muscle is defined, that we call them ripped and shredded, but their blood pressures are 210/120. That genetics is immutable. That West African genetics, you can't fight it. You have to go to the doctor. So as young as age 15, African American men will start showing up with high blood pressure. Diabetes runs in our community, and diabetes is all about taking sugar that your body can't process and coating every single part of your body, whether it affects your nerves and causes neuropathy, whether it starts to eat at your eyes and causes blindness, whether it goes to your heart and starts to increase your chances of heart disease and blood pressure, high blood pressure. Those things are critical. So you've got what you can do, what you can control, what you put into your body, your output heart-wise, but they're the things you can't control. Genetics, genetics, genetics. So within communities of color, within our Black and brown populations, but also, so guess what? White men, coronary artery disease, okay? Black men, it's usually high blood pressure. White men, it's usually heart disease. You can't control for that. So that's when your clinician, your nurse practitioner, your PA, your physician comes in, and having a dialogue with them as to what's been going on in your family, what are your innate genetic predisposition to disease, in addition to how you eat, how you sleep, how you exercise. So all three of those components, diet, exercise, and a relationship with the medical professional evaluation are critical to heart health.
And Dr. K, before we move off to that point, the question did come up about the testing. Is there a particular testing that they can do to test their blood type or test their blood when it comes to what foods they're affecting?
Now, that is something I can't speak on precisely. Your blood type does drive what type of foods you are compatible with. That's kind of more a holistic thing. There are lots of books on that, but I'm not completely up on that literature, but that is something that I have heard of. You can test for blood tests that you could do. You always want to check your HbA1c to see if you are at risk of developing diabetes at an early age. You want to protect your eyes. You want to protect your nerves. You really do. So that is probably the most important test I could recommend to folks. There, of course, blood test wise is a fasting lipid panel to see whether or not you are processing lipids. And so we say avoid meat. But for some people, especially your diabetics, guess what? That's what they have. They eat protein and greens. So they're going to be heavy on that protein. And so then what type of animal proteins are you putting in your body and how are they affecting it? Can your body break it down? So those are the two main tests I would recommend to see your predisposition to cardiovascular disease.
Dr. Booker, so since we are coming out of our winter storm and we're still in the pandemic, what would be your advice to someone that's feeling very anxious or their anxiety is very high?
Well, I think that like Dr. K said, a lot of the things in managing anxiety and mental health in general is understanding what you can control. So anxiety is a result of being in a situation where you feel like you don't know what the outcome is going to be, you can't control the outcome, and you're spinning in a way to try and manage it, but there's no way to manage it because you have no coping mechanism for that entity that's causing the stress. So really, part of it is understanding, what you can control, what you can't, and recognizing when you are experiencing symptoms of anxiety. So if it's a different state. If you're worrying more excessively than you normally do, or if you are having problems concentrating. I mean, if you're normally can get work done, but you're finding out that I can't focus on my work, I can't even, sit still without thoughts popping into my head, recognizing that these are all signs of anxiety. And so when you're thinking about that, you think about what aspects of my life can I control? And when you think about mental wellness, there are a number of dimensions, and I'm glad that Dr. K mentioned it, because the physical aspect is one aspect of the things that you can control. You can control how much exercise you get. You can control what your physical environment looks like, what your space looks like, if you have room to breathe. You can control the people. Well, when we're in lockdown, we can't control the people we're around, but you can control the people you choose to connect with socially. You can seek out people, through like church organizations or communities like that support you feeling safe and calm. You can connect with your spiritual self, understanding there's something beyond you that's important. Those are all things that can help reduce your anxiety and help you deal with these things we can't control. You can't control the weather, okay? You can control how you react, and you can control looking for resources to help you manage that. You can't control whether or not you're going to get COVID. You don't know, but you can control creating a safe environment for yourself, going places, wearing your mask. These are all things that can give you some solace and control, and things that you can control the people around you, saying, I'm not going to be around a person who creates this dangerous environment for me. I'm going to be around people who create a safe environment for me. These are things that you control. It can really help you reduce your anxiety and all of the things that we're experiencing.
Great. Yeah. Tanya, so we were talking about stress, and we come out of our winter storm, and some of us are fear. What concerns does that present for a pregnant woman when we're trying to boil water or figure out how we're going to stay warm?
Well, that's a good question. As you know, there are some dietary restrictions when you're pregnant, because there are some things like listeria that you find in lunch meat, and that may be the only thing in your refrigerator, right? After the storm, you have a package of turkey or ham back in there. So if you're worried about things like that, it is important to boil the water. It is important to make sure you're putting things in your body that won't harm your baby. Tuna, you have to be careful which tuna you pick to eat when you're pregnant, because we don't want to put too much mercury in our bodies, because that can affect the baby's brain development. But if that's all you have, and then you just got to do with what you have. whenever you're eating something like lunch meat, or that's one of the main ones, you want to zap it in the microwave if you have electricity, and that'll take the listeria away, because the cold actually doesn't prevent you from getting listeria, crazy enough. And then fish is okay to eat in pregnancy. You just want to limit it to about twice a week. Trying to think of anything else. And then, you know, getting your vitamin D, getting your sunshine. And then, you know, when in pregnancy, a lot of people think they're eating for two, and that's time to just eat whatever you want, right? And that's probably one of the most dangerous things you can do in pregnancy that affects you. It can increase your risk for blood pressure, increase your risk for diabetes, make you higher risk for having a C-section. So you want to gain the weight, talk to your provider about what they recommend as far as weight gain in pregnancy.
Okay, I'm glad that you said that statement about you eating for two. So you need to manage your own weight and then be healthy for the baby. So is it clear? I'm glad you clarified that, because I was like, I'm eating for two, but you have to manage that. Good. Okay, thank you. So Dr. Cunningham, I want to come back to you because now we have a lot of questions coming in about grief. So a particular person, they have lost someone to COVID, and they just want, how do they deal with that grief and that loss?
First of all, there are different types of grief. Of course, we have normal grief, which is already challenging to deal with. Then we have what we call complicated grief. And that is basically what it says in its simplistic form. You know, there are factors, how a person dies, how their age, if they were younger, will impact where they died. All of those things will kind of complicate the grief. And because they died in a pandemic, the COVID, what we're in, COVID-19. So that has automatically moved people into what we call the complicated grief arena. It has impacted not only how we grieve, but has impacted our disposition. Many people couldn't have funerals and things like that in the normal way. And that funeral is the place where we go to get that extra support. So again, I encourage people to basically just acknowledge that and know that it's going to be a little bit more complicated than your normal grief, but definitely get some help to kind of talk about that, because the complexities we have with COVID is definitely going to make your grief process a little bit more intense. There's some things a counselor can talk about.
And then can you identify with someone that is dealing with suicide and then COVID at the same time in the grief process?
Can you repeat that? I didn't hear that.
Dealing with suicide and the COVID in the grief process?
Yes, suicide is at an all-time high, unfortunately, right now, because of the pandemic that we're in. And again, because of some of the predispositions that one of the other panelists mentioned earlier that we've been exposed to, many people are suffering silently. So we're glad that we're having symposiums such as this, so we can remove that stigma so people can talk about that. Most people don't understand the power of talking. What we're doing here today is very, very powerful, providing this information and allowing people to know that they are not, quote unquote, you've heard this word, crazy. Right? You're not crazy. Mental illness doesn't mean that you're crazy. So we want to be able to address those suicidal ideations. And reality, there's a difference. Suicidal ideations means that we think about it. And reality, a lot of us have thought about it. Let me just be transparent. I thought about it. I just didn't move forward with it at one particular point in my life. So we don't want people to move to that point. So talk about the suicide and dealing with COVID and things like that, so that you can process through that complicated grief.
Now, I want to go back to Dr. Booker real quick, and because I want to identify that. What are some things that if they are dealing with suicide and their kids have COVID and things of that nature? What are some mental health things that we can suggest for the community?
Okay, first of all, you know, when we talk about mental illness, major depression is a mental illness. And frequently when people have major depression, one of the symptoms is suicidal thoughts or suicidal behaviors. So we're dealing with two different things here. If you have a mental illness, which if you are suicidal, it is likely that you are dealing with a mental illness, then you need to get support for that. And that includes seeking help from a professional, okay? And following, and if you already have a mental health diagnosis like major depression, you need to follow the first of all, get an understanding of what it is, what depression is, and follow the support or the guidelines for prevention, for intervention, and for rehabilitation that are probably have been given you if you have that diagnosis. If you have a final diagnosis, you've been given some information about it, how to manage that. And a lot of times when people are feeling better, they'll stop taking their medication that has kept them stable, or they'll stop seeing their counselor, or they'll stop engaging in those social behaviors that help them lift them out of that depression. And so then they fall back down. And COVID has been a big culprit for that because people haven't had as easy access to the medical professionals. The telehealth has switched, and some people just don't like telehealth counseling, or they don't have the social interactions that have helped keep them stable, even if they have a mental illness or have been suicidal in the past, which has made those people who are functioning very well with their mental illness have, kind of de-escalated and triggered back into a state that's less manageable, increasing the suicidal rate. Okay, so now those group of people, but there are people who are mentally healthy or don't have a diagnosis who may feel those thoughts because they've never felt as isolated as this before, and they may have experienced suicidal thoughts or had suicidal behaviors. With them, you go back to the basics of recognizing that you are moving into this state. You really have to be self-aware as a person about, am I more irritable than I used to be? Am I more angry than I used to be? What is going on with me right now? If you recognize that early on and understand that there are avenues for reaching out to get support, that's a preventative measure for me leading into a different negative state. You have to understand, and one last thing I want to highlight the dimensions, 8 dimensions of mental wellness that we have to think about when we're thinking about keeping ourselves mentally healthy, okay? One of them is our emotional state. Are we sad? Are we around? Are we happy? Are we able to cope when we experience a grief instance or a situation? That's the emotional. The second is the environmental aspect of our life. Are we occupying ourselves with stimulating environments that are healthy, that keep us engaged? That's something to consider. The other is the financial environment you're in. Are you in a stable place that keeps you safe, as I mentioned before? Are you in an occupational, or do you feel satisfied and enriching in the work that you do? And are you able to find some enrichment in that? The other is the physical that we've talked about quite a bit, is that are you engaging in activities that are keeping you mentally well? The other is social. Are you engaging with people? Are you interacting? Are you reaching out and finding ways in this closed environment to do that as possible? You have to find those ways. And then the spiritual aspect, expanding your meaning of purpose, the meaning of your life. Those are the areas that will help keep that balance when we have these stressors, or we are going to experience situations that cause grief in our life. And so if we create environments that allow us more able to cope with that, whether you have a diagnosed mental illness or not, the outcome is likely to be better. I know that was a lot.
No, that's really good. I want to swing over to Dr. NEWSOME real quick. Are there any type of vitamins or supplements that an individual can take to help lessen their cholesterol?
Lessen their cholesterol. Amen.
Or lower their cholesterol, sorry.
Lower. So there's niacin, which is B1, and there's also garlic. So those are natural supplements that can lower cholesterol per se. Is that a question from them? And that's, for cholesterol, otherwise that's pretty much it. Now, when you're taking some of the products that have been out there for COVID or COVID prevention or maintenance, or after you're getting over COVID, there was a question in the chat that I'd like to answer about the person that had been diagnosed with COVID that had said, and I don't want to get out of order, but zinc, short answer is zinc. Zinc, 220 milligrams. 220 milligrams a day should do it and help them bring their taste back. Comes back in about, well, studies show about a month, but honestly, if you're on the end of COVID, probably about 14 days, about 2 weeks. And then the question about the garlic, one that doesn't give heartburn. Well, there's the garlic, and that's how it ends, IQUE. That one, and you know what? You can even find that at the dollar store. But that garlic, I looked at the supplements, and they're actually the same one that's $12 at Walgreens is $1. You don't get as many, but it's $1. So you can see if you can tolerate it, because with natural products, that's the thing, you know, are you going to tolerate it well? Because of natural products, you know, the potency and different things, it's not the same as when it's a prescription medication where it goes through all the clinical trials, right? So you may get varying potency and, you know, and different excipients that you may not tolerate well. So if you're going to try something like that, the dollar store is a good source.
Thank you. Dr. Goro, when it comes down to our lungs and our body overall, there's a question about detoxing. Now, is it beneficial to do a detox, or is it harmful?
I mean, that's too general of a question, you know, and sometimes we want to be, you know, I mean, in this forum, I try to present evidence-based medicine, and there's a danger in, there's a lot of things that have no, I can't answer that safely, you know, because there's, I don't want to never say never, but it's too general of a question, number one. Number two, I kind of pause a little bit when somebody starts talking about detoxification, you know. And if it's specific, then maybe I could comment on something, but other than that, I can't really safely comment. Yeah.
Dr. Booker, I want to go back to you. So we have a question, and they were diagnosed with COVID in the beginning of the year, and they've gone through the stages of some of the symptoms, but they want to know, is that affecting their mental thoughts?
Again?
So they were diagnosed with COVID in July, but they've gone through like the symptoms of the sweating and the taste of losing the taste and other things, and they're trying to figure out, is that affecting their mental thoughts?
I mean, I'm not sure particularly for them, but it is likely to. I mean, because anything that changes your what a normal state of healthy functioning you feel like you have is likely to impact the way that you feel about yourself, your mortality, and your functioning, your ability to be able to function normally. And the thing is, and always, whenever we have situations in our life, is to recognize the changes that we have gone through. And I think that Dr. Cunningham can probably speak to this well. You have to recognize how your life has changed and how you want to live it with those changes. Change is scary, but it's not necessarily a bad thing if you learn to cope with and embrace those changes in a healthy way. And I just want to mention that I put on the chat the National Suicide Hotline, because it's a very important issue. I want people to recognize that if they're feeling that way, there are resources available to you. So that number is on the chat, and visit the National Suicide Hotline or website if you're having issues and you want to talk to someone. So,
and that's really good, because the suicide hotline is open 24 hours a day. So they're always there, the crisis center. So please, that is a resource and our tool. Dr. Cunningham, I want to, since she brought that up, what is that process when that's a loss? You know, we lost that taste, something that we're accustomed to, or smell or hearing. How do we process that when it comes into grief? Because that is a form of grief.
It is, again, just understanding. There is language that goes along with the grief community, and it's very important that we understand what that language is. A lot of times, especially in the faith community, we will share with people thinking that we're helping them by providing spiritual responses, when in fact they don't need spiritual responses at that moment. They need emotional responses. So a loss is a loss. So
Wow.
lost your taste, you want to acknowledge that. You lost your physical response. I had one young lady come to a grief support group just to learn how to be a facilitator, but her life had totally changed. She was only 30 years old, slipped into a coma for 6 months, came out of that coma, but she's different due to the disease that she has. And in the middle of that grief group, she started crying because she finally recognized, oh my God, I'm not the same person. I need to recognize that. So it's very important, whatever loss you're experiencing, independence, normalcy. Of course, with COVID, people have lost their jobs, lost their homes, lost their food after the storm. Imagine buying all of this food, going to the grocery store, and then you lose your electricity and you lost all of that food. So again, it's important to acknowledge that loss is loss and it must be mourned, not just grieved.
Okay. And then since you keep saying that mourn and not grieve, what are some ways that we can actually acknowledge it and mourning? What are some steps you can give us to make sure that we're actually doing the work to mourning?
That's right, doing the work, grief work. There's a term that we use in the grief world called grief work because it is work, and this is why a lot of people don't do it, because it's work. It takes emotional work, it takes your mind, mental work, and you've got to be willing to do that. So mourning, what is that? Remember, it's that external expression of what's going on the inside. So talking, again, is very cathartic, very therapeutic. So if you don't want to necessarily talk to anybody, journaling is also a way of doing what I call mind dumping. And not for you techies out there, not that electronic journaling. There is something magical that happens between the pen and that paper. You see, I got my paper, I'm old school. I'm writing notes, what everybody else is saying. So you've got to be able, I see your notes, Dr. Newsome. So you want to express, Dr. K, you want to express that. And again, your mourning and grief work is gonna look different than someone else. I had a couple whose young 12-year-old died. And the husband wanted the wife to get up to go exercise to the gym, and the wife was depressed and she wanted to stay in the bed, want the husband to stay in the bed. I said, no, wife, you stay in bed, husband, you go to the gym, because everybody has their own way of processing it. So that's just a few ways, mourning, journaling, talking, exercising, gardening, whatever that is for you. You have to find out what your grief work is.
Okay, thank you, Dr. Cunningham. Dr. K, what are some things that we need to precaution ourselves or probably put in place as we continue to go through the pandemic? And we don't know how the weather is going to be here in Texas, but what's something we need to kind of begin to practice now so that we can be prepared for something if the weather changes again, or we're still in a pandemic.
Could you repeat your question? What do we need to do to prepare for?
Like, what's some self-practicing things that we need to start putting in place to prepare for another bad storm, or just how to live within the pandemic since it's not going anywhere anytime soon?
Yes, since the pandemic is not going anywhere anytime soon. My goodness. I will use this moment on my soapbox, everyone, to say, get vaccinated. That's the first and foremost. If you can get vaccinated, get vaccinated. I've been vaccinated. I had a team of young, well, I guess we're getting older, but young nurse practitioners and clinicians and physicians with me. We all got vaccinated. I've been on multiple teams in multiple nursing homes where we've all gotten vaccinated. But I think the best thing is guard your heart, as you said from Psalms, to begin with, guard your heart. This disease gets your heart, it gets your lungs, it gets you in the pocketbook when you can't work for 60 days. So we don't need for you to get this disease and then be sidelined, unable to take care of yourself, unable to take care of your family. So I strongly encourage, get vaccinated. I will, of course, encourage, as always, exercise. Move your body, because that guards against inflammation of the heart, inflammation of the blood vessels, inflammation of anything. Take a look at your finances. That's outside of the health range, but do have money in case of a bad day, if you do get this disease, it requires financial resources to take care of. As the folks who were able to take care of their family members and all their dogs and cats, and that took some money when all of a sudden all those folks came into your home and you had to feed them. So those are just, you know, basic precautions. But again, with the guarding your heart, whatever it is that you do that takes care of you emotionally, whether it's sleeping in for an extra hour, whether it's sitting in the bed and just taking some time to watch some TV and have fun, you know, or taking some time for a walk. Again, it doesn't always have to be exercise, but doing those things, meditation, yoga. Again, I mean, I wouldn't encourage substances, but even if it's having a nice cup of tea and just thinking, for those of you who take comfort in the Bible and the Word of God, take some time to do that. Lord, it helps the soul. So those, you've heard all the health things that we need to do in this pandemic time. Get vaccinated. This thing isn't going anywhere. Get vaccinated. Encourage those around you to get vaccinated. It allows you to socialize. It allows you to go out. It allows you to be free from constant anxiety. Am I getting this? Do I have it? Is my cough COVID? I mean, how many people have been tired of being afraid of having COVID? Right? Isn't it exhausting? Isn't it a constant state of anxiety? Get vaccinated. Get out of it. Okay, so those would be my biggest recommendations.
And then before you go, is there a connection between hair loss and heart health?
Yes. Not the hair loss associated with being you know, a young male and the surge of testosterone, but definitively anything that cuts off a blood supply to your skin will cut off blood supply to your hair. So if you take a look at older people, it's kind of almost a fascinating little study. Just go take a look at people over 60, look at their calves and see if they have hair. One of the first signs of peripheral vascular disease is the loss of hair on the lower extremities. It's then followed by the loss of skin color. Essentially, it's hemosiderin deposits, which is basically blood deposits itself in the blood vessels, and it makes everything darker. Or then followed by, it progresses to ulcers and wounds. But hair loss anywhere, yes, is related to your heart health.
All right, thank you. So we're going to begin to wrap up here shortly, but I want to make sure we address this question. Dr. Booker, if you can, how can we prepare our children or have the conversation with our children when it comes to like COVID and death? How can we have that conversation with our children?
Okay, well, I mean, and part of it is starting early to help kids understand the cycle of life, you know? I mean, if they've had pets or they've had like family members that have died, they really need to understand that, you know, part of the cycle of life is living and dying, and helping them understand how they want to live in a way so that if they lose people around them, they can appreciate the time they've had together. And if someone does die, you know, the tendency is to shield children from that and the pain of that, and not let them like just ignore that they might have been impacted by it. But even if they don't directly hear about it, they're going to hear about it. Children are not unintelligent, especially now. You know, in fact, my children, you know, we got an email about a girl that committed suicide in their school. Now, I can do whatever I can to protect them from hearing about death in my home, but they're going to hear about it. They're going to go to school and they're going to hear that this girl, you know, who was in their class, killed herself. So really, when you know there's a situation like that, you have to talk to your children about them. You have to ask them how they're feeling, what are their thoughts, what they need from you to help cope with the situation. What do they think about death? And, you know, children are not going to react the same way we do about thinking about their mortality, because they're so far from it that they're not going to think, you know, for us, it's like, oh, you know, we're going to die soon. They are really have to understand that grief and loss. And I want to give that to Dr. Cunningham, because she can really talk about how children can process that, because I'm sure she's dealt with children. But I do want to, before I go that, I want to address, I think someone put in the chat resources for if you need mental health support, you can't afford it. There's and I'll put it in the chat response. Texas has created through Texas Health and Human Resources line through COVID-13 a hotline if you don't have resources and you want to get mental health support. And that number is 833-986-1919. Okay. So it's a way to help support people who are dealing with COVID and death of COVID and just the whole milieu of mental health issues that come with that. There are also some organizations that offer pro bono mental health services. I think Alliance Child and Family Solutions is one place. They have an office in Fort Worth that they offer services. They're a nonprofit, so they'll offer mental health services on a sliding scale and sometimes for free if it's necessary. And also people can check with MHMR, or if you have a job, a lot of times your job will have an EAP program. That's a program that allows you a certain number of counseling sessions through your company, and that you may not even be aware that you have access to. Even if you don't have health insurance that provides that for you, check with your company. They may have a program that will provide mental health counseling for you for free.
And then I want to add to that, call 211. They have a lot of resources on there that they are providing for the community now, especially with the pandemic. So that's another good resource as well. And Dr. Cunningham, if you can share us from your perspective on how to deal with the, how to communicate with our children when it comes to COVID-19 and death, that would be great.
Yes, Dr. Booker is so right in that about children. They are more resilient than we are as adults. Really, they'll bounce back. You know how children will fight, and then 2 minutes later, they're playing together, not adults. You do something to me 35 years later, I'm gonna hold it off. I'm not even going to my class reunion because I'm still mad at what you did several years ago. So children, just like she said, you want to teach them or they will get it out in the community. So teach them about the death and they'll be able to understand it. Of course, it's age appropriate information. The Warm Place is the facility here that I refer a lot to in the city of Fort Worth. Of course, they have a waiting list. So, but I encourage people to get on that waiting list, and then we can connect you with other resources to kind of be specific to the children. But definitely all of those questions that Dr. Booker mentioned, ask them that. Ask them. You know, even when you're dealing with suicide, people are afraid to ask people who are suicidal, are you suicidal? No, they're already suicidal. So do you feel like harming yourself? Go ahead and confront that and ask that question. My website is drtonyacunningham.com, and I have a resource page there specific for pet loss. My pet is right here. Many people who follow me know about Miss Cunningham. If anything happens to this dog, let me just tell y'all, you're gonna have to help me through my grief. But loss, children, there are resources on there specific to children, but I also wanted to mention the elderly. I couldn't find that question, Dr. D, in the chat. Somebody mentioned about elderly people. My eldest client is 91. I used to believe that old cliche, you can't teach an old dog new tricks. That is not true. Yes, you can, because it all begins with the mind, like all of these wonderful speakers are talking about. Again, it begins with the mind. So my eldest is 91, then I have a 90, the next one is 85, and the youngest one is 10. Why am I sharing these ages? Because again, grief crosses all cultures and ages. It's generational. So it's very important that you address it. If you have a senior that is experiencing grief, you want to talk to them about that, because a lot of them not only lost their loved one, they lost their home, their lost independence is a huge one in the senior community. Oh my God, they go through the grief process because they're not able to do the things that they used to do. Okay, I'm sorry, Dr. D.
Thank you. So this is for Dr. Goro and Dr. K. Is there any way as we move forward for the vaccines is going to be opened up to just general population as far as right now it's just for specific populations. Do we see that changing anytime soon?
I mean, I think it's going to change. You know, obviously, one of the complex things is that each state has different requirements. You know, and then and not just the state, even the local government areas too. You know, but given the current administration's plan and the trend of things, even though it's not quite where we want it to be yet, but I think they've made some good strides, you know. Obviously, the weather too complicates things a little bit now, so that's been a big factor. But yeah, so it's hard to say. We'll have to wait for the time and the recommendations to change.
So we are going to. I want to
speak.
Go ahead. Okay.
Oh, I'm sorry.
Go ahead.
I'm trying to find the raise your hand button. So I can probably speak to the vaccine. So the wintry storm put us back, right? So the anticipated time frame was for Walmart to get their vaccines first, and mainly because like Walmart, they're everywhere, and they're in rural areas as well, and so Walmart was supposed to get theirs around the 11th, right? And so then after Walmart, CVS, which is why we contracted with CVS, they're getting it next, and so we're going to do the most vulnerable community, and then after CVS, Walgreens falls in right behind that. So the goal was by the end of March, you had rolled it out in Walmart, CVS, and Walgreens, and then the independent pharmacists were going to come in. So we were going to be last, which is why I partnered with CVS, so we can kind of get in there. And but now with the wintry mix in Texas, because yay, we Texas, but in another sense, it's because of the wintry mix, the 600,000 vaccines that we were going to get that were going to be distributed among those of us, they have, of course, that's put back, not because the vaccine isn't here, but because when you start rolling it out and you're rolling it out to seniors first, I think Governor Abbott just decided that teachers were going to be on that list. So instead of teachers being like in the 3rd tier, I think they're going to be in the 2nd tier. And that's why you see on the news where they're saying that so-and-so said that, and I don't know, because I don't want to name, anybody, but said that, it's not required for schools to open back up, for teachers to get vaccinated, for schools to reopen. Well, that's bigger than what it looks like. So when they say that, then that means that pushes teachers on down the line. So essential workers, so you have the essential workers first, then you have the seniors, and then you'll have the teachers, those of us that have to work in the public arenas. And so with that, now the anticipation from as far as late as last night is probably other populations will be considered after now we're on past March, and in the spring, past spring break, probably April, before anybody that wants one can get one. We're looking at probably about April in the state of Texas, which is actually, that's still ahead of schedule.
So before we get closer in, if all of our panelists, if you can drop your information in the chat box so that our attendees can have your information if they want to reach out and schedule an appointment or get more resources. I want to allow time for that to take place. Also, I want to thank all of our wonderful panelists for coming in and sharing the information today. I know that we cover a lot of information in a short period of time, but it was our heart and our passion to make sure that we address these things, especially with us going through the pandemic and then not knowing that we would go through our own winter mix here in Texas that was mind-blowing, but just to say the least. We hope that this short talk blessed you or help you do something that you're facing. It gave you a sense of hope, some peace, and maybe help you heal some things that you are dealing with. I know this is our pastor's heart, that we are people's people. And we just want to make sure we're extending his love to you all. If you have any questions, please feel free to reach out to the church and we'll make sure we're able to direct those things. If not, I will let each panelist say their final words and we will let this thing go. And we'll start off with Dr. Cunningham.
Am I first all the time because my name begins with a C? I was just wondering. I'm like, why you call me first all the time? All right, listen, I am so glad that all of you were here today. What does that say about you? In my opinion, you are a rock star. Why? Because you're here to gather that information. Many people say they want change, but they're not willing to do the necessary things to change. So not only not only come here and listen, but go and apply all of the information. Thank you so much, Dr. D, and to the pastor and everyone for this opportunity. Blessings to you.
Thank you. Dr. Booker?
Yes, I just want to first of all thank you all for inviting me to participate in this panel. I so enjoy sharing information and talking to people who are really interested in health in general. And I just want to remind people to engage in those preventative measures that help in general. I mean, create a good environment for yourself. Recognize when you're feeling unusual or stressed and do the things that you need to do to connect socially with people, to get the exercise you need and be healthy. You know, it's really important in this environment. If we can survive this, we're in a good place going forward. So this is the best time to start using those techniques to improve.
Thank you. Dr. K?
I wanted to say thank you for inviting me. It was wonderful learning from everyone, Dr. Newsome, Dr. Cunningham, Dr. Booker, Dr. Agoro, Ms. Lopez, thanks for all you do. And just everybody continue to take care of yourself, take care of your heart, not just physically, but also emotionally. As you see, it's incredibly important because emotions do drive also how we do physically. Thank you.
Thank you. Ms. Tanya?
Thank you so much for inviting me. It has been so much fun to meet everyone and just to be able to share just little tidbits of knowledge that I have and learn from everyone else. I wanted to add one thing that none of us mentioned, and that is do not smoke, because smoking is one of the worst things you can do for your heart. So anybody on here that's smoking, I want you to go find a smoking cessation seminar today and stop smoking. And then the last thing I want to say is, as far as maternal health goes, if you don't feel like your provider is listening to you, if you don't feel like you're giving symptoms of chest pain or shortness of breath, or you think there's something going on, then you just keep beating that door down until you are listened to. And if you are not being listened to, go somewhere else. You can go to an emergency room, you can go, there's all kinds of other options for you. So just hang in there and you know, speak up, and like everyone else said, take care of yourself. Your mental health is just as important as your physical health. So thank you for putting this on today. And for letting me come and join you guys.
Thank you. Dr. Agoro?
Yes, well, thanks for the opportunity. I think the important thing I'll say is having been vaccinated, I would want to encourage those that have the opportunity to please get vaccinated. Get the information you need, but at the end of the day, from what we've seen, I think I would encourage anyone to get vaccinated, everyone. Thanks.
Thank you. Dr. Newsome.
Oh, I'm already unmuted. Okay, so I agree with getting vaccinated. However, I would encourage those of you that are feeling a little reluctant about getting vaccinated to go ahead and they have the rapid test now. I think some of the complications that we were talking about last night, some of the complications are from people that are asymptomatic and maybe already have, it's kind of like when you get the flu shot. You know, if you were already prone or if you were getting the flu, you can get the flu shot and think that it gave you the flu. Well, there are some people that are having, you know, some reactions, and you're going to see it all in the media about having reactions to COVID vaccines. Have the rapid test done first. And if you're clear, if you're negative, or if you're positive and asymptomatic, don't get it. But if you are negative, then that gives you a comfort level to go ahead and get vaccinated to protect yourself. I'll also put in the chat some of the supplements that have been proven, evidence-based, like Dr. Agoro said, evidence-based, that have been proven to either shorten the span or not make COVID as detrimental. And that was the vitamin D. I think I put it in there twice, but it's the vitamin D3, any of them. The vitamin D3, echinacea, elderberry, vitamin C, and zinc. And if you've had COVID, like we mentioned before, and you've lost your sense of smell and taste for whatever reason, zinc has a tendency to shorten that, that sign and symptom. And oh, I'm so glad to be here. I always come and I get to be a student, and this time I got to share. So thank you for that honor.
All right, thank you. Well, I want you to go out and enjoy your Saturday. You have been informed and empowered. So I hope that the rest of your year, you're able to conquer this thing, because we have all the tools and resources right here for you. God bless you, and we'll see you later. Bye-bye.